Welcome to Magnolia Medical Minutes, your local source for medical advice, direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens with Super Talk Mississippi Media. Today our topic is anxiety and depression, something that most of us have faced at least one time or another. Our special guest today is Dr. Joy Smith, a combined adult and pediatric doctor at Magnolia Internal Medicine. Thanks for joining us, Dr. Joy.
Thanks for having me, Andy. You know, I've seen quite a variety of adults and teens and children going through hard times. And it's important to realize that being sad at a loss or being concerned at a disappointment is really normal and appropriate. So times of sadness can be helpful as a natural grief process. But where it becomes a problem is when it becomes a habit of thought that persists month after month, year after year. And so then if you find yourself in this constant funk that you can't seem to break out of, that's when seeking professional help is a really good idea.
Right, so you're saying that, let's say my parent or spouse dies, and I feel down, I don't need to necessarily go straight to the antidepressants?
Exactly, right. But if 6 months later, you still find yourself unable to move forward, that may be a sign to make an appointment with me or one of our other primary care doctors in our area.
Dr. Joy, that makes a lot of sense. I'm glad you said that. So let's say I do realize that I need more professional help though. What does that start to look like?
So, you know, sometimes medicine is needed just to help a patient be able to hear the encouragement that comes next. But medicine is not the mainstay to treating anxiety and depression. And there are some very simple treatments that are actually more impactful than some of our commonly used antidepressants. So this may sound a little too simplistic, but just getting out in the sunshine for a 20-minute walk each day can be powerfully effective. Now, another thing beyond that would be a consistent get in bed and get out of bed time every day. And also minimize screen time, both before going to bed and then after waking for a few hours.
So we've covered physical activity and sunshine and good sleep patterns, hygiene, those type of things. But what else is there?
Nutrition is the third most important part. Make sure there are plenty of fresh vegetables, fruits, whole grains, lean proteins in your diet. And then also vitamin deficiencies or hormonal changes can impact mood. And that's where some professional help can make a big impact. Now, there are lots of clinical scenarios that can contribute to depression and anxiety, and making sure that those conditions are treated well provides the best chance for renewing your mind.
I appreciate your time that you spent to give us some tips and tricks on how to fight anxiety and depression and things to watch out for. So
thanks for having me.
It's been great. Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical advice directly from the doctors at MRHC in Corinth.